You're listening to Stellar Success, Leveling Up for Medical Pros with Dr. Tudor Francu. Join us as we explore how medical professionals can achieve stellar success in all areas of life. It's time to level up.
Hello, everyone. We're back at Stellar Success Podcast. And today I have a pleasure of having a great guest, a public figure, actually, a physician and a great person, Dr. Aimee Duffy. Dr. Duffy, how are you?
I'm doing fantastic. How are you?
Awesome. Where are you calling from?
I'm in Clemson, South Carolina.
Great, great. Tell us a little bit about yourself. Just in a few words, what was your journey? How did you start it? How did you get to where you are?
I don't know if I can put it in a few words, but I will do my best. It goes way back when I was a little girl. I just absolutely loved babies. Any baby I could get my hands on, I wanted to play with, hold, squeeze those chubby little cheeks. And I had Cabbage Patch dolls that I just played with and thought they were real. So I started babysitting when I was 11 years old. So it was kind of my first, business, if you want to call it. And that progressed through into high school and even college. And one of the families I babysat for was having baby number 2 and actually invited me to be in the delivery room with them to experience this. I was very close to this family. And so when I got to experience this delivery, I was just in awe. I thought this was the coolest thing ever. And that's what I wanted to do. I knew at some point I wanted to go into medicine, but I didn't quite know. I thought I was going to be a pediatrician because I just loved babies so much. But when I saw the delivery side, I thought, okay, I'm going to go do OB. So I did college, medical school, and ended up actually doing a family practice residency because I didn't realize at the time that you could still deliver babies as a family physician and then also get to play with the babies after. So, it was a nice win-win situation. So I went into family practice, delivered tons of babies, and had a very unique opportunity to join an OBGYN office next door to the family practice residency program where I graduated from. And so it was this opportunity to keep delivering babies, not really do any surgeries, but then be primary care for the women who delivered with us or that were there to see us as GYN. So I got, sort of thrown into the women's health world that I had very little training from a family medicine perspective. And when I wasn't delivering babies, I was seeing patients in the office, for women's health stuff. And this whole hormone thing was kind of a big conversation of, are hormones okay? And even I didn't know the answer to that. We were all sort of confused with the Women's Health Initiative of what we were supposed to do with hormones. So I felt like I didn't have enough information about that and the answer. So I decided I needed to do more investigating on what in the world we're doing with these hormone things. And I happened upon a natural hormone balancing conference that was my first introduction to the world of bioidentical hormones and what we now call functional or integrative medicine, but it wasn't called that back then, or at least from this perspective. And to me, it was kind of like Alice in Wonderland going through this tiny little door into this world of amazingness that I had no idea existed. And so it started with hormones, realizing, okay, if you could just see what the imbalance was and then correct it back to normal, then, women would feel better. So we're not having to Band-Aid these crazy symptoms with birth control pills or with antidepressant medications. We can actually get them feeling better. And so that started that process. That business that I was in, that OBGYN office actually got bought out by the hospital system. And I knew that was not the direction that I wanted to go, especially with this newfound kind of integrative approach to doing things outside the box to some degree. So I ended up opening my own practice. That was in 2011, so 13 years ago now. Actually, October was the anniversary of opening my practice in 2011. And here I am today. It's just kind of been this whirlwind of start with one thing, and it's just exploded into really what we do now is whole person, whole body health. So we're addressing what I call the 5 pillars of health. So we definitely do hormones, but we address the gut, we address toxins and detoxing. We address nutrition, we address stress management, mindset type stuff as well. And I always say, I'm a doctor that gets people off drugs, not puts them on drugs. So, people come to us just falling apart. Their life is just not what they want it to be. They're miserable. They're gaining weight. They're exhausted all the time. They're gut's a mess. We just hear 100 different issues that people are going through. And really, when we kind of put all those things together and get to why they feel the way they do, then we can transform their lives. So that's what I get to do now in my practice. And then what I love, I think, even more is training other practitioners to do what we're doing. So whether it's on the clinical side or the business side, a little bit of background into my business part, which, I know this is kind of the business of medicine as well, is that I started my practice trying to do the insurance model and, billing insurance for this alternative stuff that I'm doing. Went into kind of a weird hybrid thing of we'll try to bill insurance for what insurance will pay for. And then we still have a membership charge, and, that kind of tanked. And I actually ended up filing for bankruptcy just for the debt that we had accumulated over the course of several years in 2020. Right. Actually, March 6th of 2020 is when I filed for bankruptcy, and March 15th of 2020 is when, the whole world shut down. So unfortunately, I didn't get any of the, support from the government with the loans and stuff because I had filed for bankruptcy. So 2020 was a very trying time from a business perspective. And I don't know how I got through that. I mean, a lot of people say, like, did you think about closing your practice? Did you think about, going back into hospital system? I could have gone and worked for urgent care probably, or in a hospital, they needed help. We all know. But for some reason, I just knew that this is where I was supposed to be and this is what I was supposed to do. And I just have to stick with it. And so, I mean, when we want to talk numbers, I mean, I went from, almost 1.2, I want to say revenue of 1.2 million, probably not profit at that time in 2020, to 2.2, 2.4, 2.4. And this year I'm slated to hopefully be over 3. So, we've done a complete turnaround there. A lot of it has to do with having mentors, having support system in place, some coaches from a business perspective, as well as medical, really getting my team in place. And now today, I mean, not only is our revenue great, but I only spend about 6 days a month in the practice actually seeing patients. And the rest of the time I'm running around, again, doing speaking, teaching, spending time on the tennis court, hanging out with my 4 kids that I, didn't get to do a lot of when I was delivering babies and they were young. So full throttle turnaround, 180 degrees, and it's been great.
That's awesome. Congratulations. I think our listeners are going to be impressed with your achievement so far. And indeed, you said something very important, that to be successful, you need to fail at some point. And, I don't know if it was a failure for you, but it's not for me, what you've been through, because I think you, as they say, you miss 100% of the shots you don't take. So taking risk is probably something that a successful person needs to do. And that's why I'm very curious how you define success for yourself.
It is something that almost every day, I try to remind myself. I mean, I'm in a good place now, but of the gratitude, of where I am versus where I used to be. I remember, especially in that insurance model, where a lot of people are, is the grinding through, 20, 40 patients a day and still having a chart at the end of the day, after putting kids to bed at nighttime, catching up on charts all the time was just, always in the back of your mind. So, for me, I think financial success is something that everybody kind of puts, thinks of right off the bat in terms of, is your business successful? Are you a successful entrepreneur? But I think what I find more invigorating, I guess, and what feels more successful is building the practice that isn't making me so stressed out. I'm not going to be the person that's burnt out and, unable to do my job, being on antidepressants and sleeping medications and all this kind of stuff, because I've built a practice and a life that's going to let me, take care of myself. And I think that that's a huge part of it. So, we were talking earlier, it's business is a success, but I mean, like, being healthy is successful, right? Like, it doesn't matter how wealthy you are, for whatever word, if you don't have your health, that you can actually do something. So that's been really big for me over the last, I think, 5 years. well, really through COVID, but really just being able to transition to manifesting how do you want your life to be. And many people have probably been in some sort of coaching or some sort of class or experience where it's like, let's do the perfect day exercise, right? Where you sit down and you say, this is what I want my perfect day to be. And I was like, well, is this in the office or out of the office? Like I had to have two because I didn't know, which one we were talking about. But I really think the more that you spend your time in that mindset of how do I want life to be, as opposed to the woe is me of what your life may be now, it just sort of
Interesting.
happens. I mean, that energy just flows and you end up with the right people that work with you. I mean, there's some great books out there. It's the who, not how, right? So, especially in the medical world, I mean, if you're so busy seeing patients, you're not able to work on your practice, right? So you've got to have people on board that can, that you can train, that can be your clone for the most part, especially from a medical perspective, so that your patients are happy. They're getting the same care that they feel like they would get if they were seeing you directly. And yet, it's not all on you to take care of everybody.
So this is an interesting concept that I want to kind of stop and pause here. The fact that you said that you developed this entrepreneurial spirit all throughout your life and you developed your practice. This is not something that we learn in school.
No.
Nobody teaches this, especially for medical professionals, right? So we go through medical school, we have plenty of knowledge how to take care of patients, but we have no knowledge how to take care of our business. And business is a big part of medical practice, no matter how you look at it. If you're practicing in a private setting or you have your own company, you need to know how to do it. How did you learn those things? What path did you think it's appropriate for someone who doesn't have any kind of knowledge and wants to do this?
Well, the way I did it and the way I would do it now are a little bit different, but either way, I mean, when I decided to open my own practice in 2011, I found a consulting service that did this, with you or for you. But it was still really in the insurance model, and that's traditional, medical practice type stuff. But I had a consulting service that said, we'll help you, open your own practice. And it started right off the bat with a business plan, where we were going to rent space, having conversations about what the budget needs to be so we know how much to ask to get a business loan. I mean, there was a lot of support there, nothing that I probably could have come up with. Yes, we have a lot of clinical, but zero financial support, knowledge, that kind of stuff. That was not anything that was really in my wheelhouse at that time. So that was very supportive and probably I would have hung on to them a little bit longer. I mean, they were there just to help me get started, but it was kind of like, okay, spread your wings and fly and off you go. And I had, an accountant I thought I was supposed to have to do my taxes, but I didn't have anybody that was like there as let's have a quarterly meeting to see where you are, to talk about what your budget is. I mean, that was probably the biggest mistake that I think I made is just not being aware of how many people are out there that could help you. And these days, a lot of what I do in teaching and helping support and mentor is being part of masterminds of, there are people and companies out there that are, dedicated to helping physicians in the business part of things.
You basically put yourself in an environment that, between people that you want to become like.
Yeah, exactly.
I see.
And then you become them, and then you teach them how to become you. I mean, that's really where success comes from, I think, and where coaching, is a huge part of that as well. But
it's very powerful. The fact that I read a quote somewhere that said the most valuable thing you can have is the willingness to persist longer than anyone else.
Yep.
And I think this is something that you probably relate to very closely since you've been through ups and downs throughout your career. And this bankruptcy, right when COVID hit, is probably something that not too many people go through. But you come out on the other side with a better mindset. And this is
Well,
something that
what I
I
can
want
say
to,
about the bankruptcy thing is I wish I had done it sooner. I was so scared of it. I actually had somebody mention it to me probably 2 or 3 years prior to that. And I was just like, oh no, that's a failure. In my head, that was failure.
yes,
And I'm sure that's what a lot of people think. So, one of the first things I'm happy to tell that story. For a long time, I was very ashamed because I thought that was a failure. My business didn't work, that kind of thing. But to be able to share that, because if there's somebody out there who's in that position that, needs to be able to do that, to move past that,
yeah.
and I'm not saying it was easy by any means, still dealing with trying to build credit back up, that kind of stuff. But man, if you're on the fence, just do it, jump in. And I say the same thing in getting rid of insurance, and everybody's different in what they're doing in their clinic or their business. But um, if you can get out of the insurance model and get away from the ties that are keeping us from really being able to take care of patients, jump in with both feet like that. It's the best place to be on the other side. People need to understand who you are and your story. And so you've got to start helping people know why you do what you do, that you're doing it for them, not for yourself. I mean, yes, I have a much better life, but it's because I'm in a happy place, right? I'm able to take care of
Yeah.
patients in the way that is so fulfilling and changing their lives rather than just watching people get sicker.
I want to focus a little bit on the fact that it looks like your mindset helped you through the most difficult parts. And I think you have a very significant particular mindset of a winner. So your failures don't scare you. They
Yeah.
push you forward, and you have the mentality of, whatever you focus on grows. Um, how important are mentors or were mentors in your life?
I still have them. I think about it, professional. We've been watching the US Open, right? Tennis. And so, these pros are sitting there. I mean, could beat the whole world except for the 5 people that are above them. And what are they doing? They're looking over to their coaches to get assistance, get support. They probably know exactly what they're supposed to do, but yet they're looking to their coaches to give them a nod or a suggestion or whatnot. And so it doesn't matter how successful you are, you could be better, and it's one of those kind of like, I don't want to say that I dwell in like, oh, it's not good enough, but it's, ooh, we're here now. Like where could I go from here? And I kind of joke, I'm like, I don't ever want to be bored. So it's like, I always have to find something else to, make my schedule busier because, there's always something coming up. But
I know that this is a funny thing. You can say how successful a person is by just looking at their calendars.
yeah,
That's what I say, right?
sometimes, it's like, can I find a minute where I don't have anything scheduled? But it is, it's okay. My business is running and it's successful and doing its thing. So now what do I get to do now? And it's like,
Right.
I've developed this whole second business of coaching and mentoring that I didn't expect ever to evolve, but it's just because people ask you questions and then you're like, oh, this could be something that I could help people with. So
Yeah, that's
what's
great.
interesting is, I mean, I go all the way back to, like I told the story, and I knew that I wanted to be a doctor, and I don't know why I didn't have this, aha moment or experience of doctoring when I was little. Of course, I had that experience with the delivery when I was 17, but I think because I liked babies, it was either going to be a doctor, pediatrician, or a teacher, and I got good grades. I was good at science. So it was just kind of like a natural thing to just go be a doctor, right? So it was just ingrained in me. I didn't get the best grades. It was kind of like, in college, C in biochemistry, I had support system there, I went to a small college and I just knew that that's what I wanted to do. And so they continued to help me to pursue, to add other things to my resume, if you want to call it. So that C didn't really matter. And then I go to medical school, and third year of medical school, I was married and I got pregnant. So baby number one, I have 4 girls now, but baby number one came in the middle of med school. Like, the worst time in the world for med students is your third year, where you're just super busy. And I remember just crying my eyes out, thinking, what in the world has happened? Of course, it wasn't planned. And I went into my advisor at the time and I told him the story, and he said, number one, you're not the first person this has happened to. And number two, you have 7 years to graduate from the medical school from the time that you enter. So, you've got plenty of time. You can figure this out. And that was probably the best advice that I had
A little,
received.
a little bit,
And,
a little bit of
you know,
perspective, right?
yeah, it's like you got time, that you don't have to be
Yeah.
in a hurry. This is fine. And I thought about it. I thought, well, my lab partner was a 50-year-old man who was back to medical school for his, second career, having been in some other engineering or something like that, So I was like, okay, that makes sense. And I can take a breather and figure it out. So I moved things around a little bit. And it's actually one of the best things that could have happened, because I ended up taking a whole year off instead of just getting 6 weeks off or a month off or whatever with the baby. Just the way that the timing of med school ends up being. Even if I had gone back, I wouldn't have graduated at the right time. So I couldn't have gone to residency, on time anyway. So I just took a whole year off, got a great opportunity to spend with the baby, and then just picked up the next year, right, with the next class, right where I left off. So, again, all these experiences that's just kind of, that could have made somebody drop out, right, and not complete it. And it was just never a question. It was just like, okay, it's just going to be a minute of a break, and off we go to the next one.
Winners never quit, right?
That I just feel like when I start looking back at all these different stories of these obstacles, quitting wasn't an option. Closing this business wasn't an option. Not going to med school with a baby was not an option. And you just persevere. It's not easy, but you figure it out.
You stay the course.
Figure out how you're going to figure this out. How are you going to find time to study, and who's going to take care of this baby for you? And you don't have any money because you're in med school at the time. So there was all kinds of things that we had to work out, but it's all
That's interesting. So right now you have this great practice. You have this great mentoring business on the side, but I'm sure you developed some skills and some habits along the way that made you this successful. Can you share some of the things that you do every day that are ingrained in your solutions and your protocols, so to speak?
I wish that I had something like the Miracle Morning. I don't know if you've ever read the Miracle Morning book, right? And I did that for about 2 years, and then I got really tired. And that was,
I know. You just have to wake up every day at 5 a.m., right?
Yeah. And I think I remember actually doing it during COVID a whole bunch. And there was just a point in time where I can't tell you what switch flipped, but I just didn't want to wake up in the morning as early as I did. And I've always been a morning person, and hopefully I'm answering your question a roundabout way. But what's interesting is that I was always a morning person, always getting up. But when we start thinking about these people who persevere and have a lot of stress in their life, and, I went to med school, I had a baby in med school, a baby in residency, whatever. The first time I tested my cortisol levels, they were tanked. Like I didn't know that they could be as bad as they were. I wasn't seeking medical care, something's wrong with me kind of thing. It was just like, oh, I'm tired. I just assumed that that's par for the course for, mom having babies and being a doctor and all kinds of stuff. Right. So one of the things that I've learned that I think is really important is that if you push yourself too hard, so if you set that alarm clock at 4:30 a.m., 5 a.m., thinking that's what successful people do, right? I got to have the Miracle Morning because that's what, Hal Elrod told me I was supposed to do. Great if that works for you, but maybe yours needs to be a miracle afternoon. You know what I mean? So what I've learned, especially again over the last 4 or 5 years, is that your body's going to change a little bit, your mindset's going to change a little bit. So one of the things I know that is important to me is that I move, and whether it's a workout at the gym or it's a walk around the building, it's a nitric oxide workout, it's a yoga, 10 minutes of yoga, something. Like, I'm a very unhappy person at the end of the day if I didn't move and do something. So that's really important. And I call it, kind of conscious daily movement. It may not always be, hardcore workout exercise, but the more I do that, the better I feel physically, but also mentally as well. Sleep really well. not getting enough sleep. I mean, again, the idea of success is to stay up really late and get up early and, grind through it. And sometimes you find yourself in a place where you need to do that. You have a deadline or something like that, but that shouldn't be your everyday life. And part of that getting good sleep is making sure your nutrition is good. So it's very easy for us to, sit on the couch and eat ice cream and, drink wine or drink a beverage. And what I find very frustratingly sometimes is that if I do have, a glass of wine or something around dinner, we go out to eat with friends or something, I don't sleep well at all. And so that really affects me. And you got to just find that balance. Sometimes that's okay if you can sleep in the next morning, but if you got to get up and you got to do what you need to do, then you have to make those sacrifices along the way that, that's not going to be the best thing for my sleep or for my health. And so I feel like I'm much more in tune to what affects me, what makes me feel really good and what shuts me down. And so, I don't have a miracle morning routine necessarily, but I know that, my days need to be movement, need to be making sure that I'm fueling my body with the right nutrition and not slowing it down. Looking at patterns. So when I'm in the office, I have kind of a week on, week off rotation right now. So I see patients in the office and it's 3 days a week with 1 day of meetings with all my managers and staff and whatnot. So those days, I know that I'm really not going to have as much time to be active unless I end up on the tennis court or something like that. But so, and I'm okay with that, rather than stressing myself out and wearing myself out by waking up early or, not doing something when I'm super tired after a really long day in the office or something like that. I just know that those days are going to be the 10-minute yoga days and that I'm going to have the weekend to be able to do, a more intense workout or get on a hike or something like that. And then the weeks that I'm working, more admin out of the office, whether I'm traveling or I'm at home, I tend to find a little bit more space in that day to get out for a walk with the dog or do something a little bit longer. So
That's a
finding
great
some
approach.
balance in your life is really important.
That's a great approach. I was about to say, I think the most important takeout of from what you said is the fact that you're balancing your days. You're not going out with some kind of preconceived routine that you need to do because somebody else said that.
Yeah.
You just
it's
feel
so,
your
okay, Monday,
body.
Wednesday, Friday, I got to work out, right? And
Right.
like, if that doesn't fit with your
Yeah,
physiologic schedule, then you're going to get burnt out and worn out pretty quickly. And then
exactly.
you're not going to see the results. So,
Yeah. So balance is very important. I agree with that.
yeah.
Um, you you are a very successful business person right now. And in the medical world, as you know, there's a lot of talk about creating some kind of passive income streams for, people that are either burned out, they don't want to practice, they're retiring. Um, how do you see this in your life? Do you have any preference in terms of passive income streams? Do you prefer some kind of investments? How do
Yeah.
you see this subject?
Um, I probably do it a little bit differently. Like I said, things have just sort of popped into my lap, unexpectedly. So whether it's speaking, which is a form of passive income, although, you got to be really, really good at that and really
Really
passionate to
active.
make it make it a career if you want to call it. But I love speaking and I love teaching. So, I feel like it just buys me a free vacation somewhere or free trip somewhere, right? So it's not really income. But what has come through that is this mentoring, teaching, coaching type thing that I didn't really know was going to be a source of passive income. So one of the things that I do is I'm a supervising physician for mid-levels, nurse practitioners and PAs, but I do it in a way that is more supportive. So I only accept people who are in this functional medicine, kind of integrative medicine space. And I don't just sign a piece of paper and say, yeah, I got you covered. Like, we actually meet and, I make sure I'm signing their charts, but I'm also meeting with them on a regular basis to coach them, help support them if they're learning about, hormone replacement or whatever part of functional medicine that we're doing. So I'm teaching at the same time that I'm being this supervising physician. And that's just growing, I would say, over the last year or so. So I don't have to advertise that at the moment. I'm just getting, I mean, almost weekly, I'm getting, hey, I've got another one for you. Or, hey, Facebook, somebody sends me a message and it's like, are you still accepting people? And I'm kind of figuring it out and developing systems along the way. So it becomes something that's reproducible, and can be super easy. So it's not taking a lot of my extra time. So that's where I am right now. From a financial perspective, like I'm still not really super savvy, even though I've figured it out to some degree for that business. But in terms of like investing in properties and stuff, like that's kind of out here. I mean, again, if it fell in my lap or something, I might pay more attention to it, but it's not really something for me anyway that catches me as an interest.
It's very useful to basically outsource your qualities and your success stories, right? Because that's what you're doing right now.
Yeah.
Looking back at you at the younger version of yourself, what pieces of advice or nuggets would you give to yourself, knowing what you know right now?
Yeah. I think in several areas I mentioned with the bankruptcy, another story we may or may not have time for. I got divorced after being married for 20 years and probably should have done that earlier as well. So, when I look back on some of those things, I think to my young self, like be a little bit more confident and be a little bit less, well, I don't want to say less scared, but when something's really scary, it probably means you need to do it. You've heard that story before, is like, it's not real unless it's really scary. And otherwise, that you just cruise on with life because you take the easy route, right? And so
you ignore the signs.
Embrace that fear, again, jump in with both feet. If something's really scary, you need to do it. And I think, I'm very happy where I am, but I think it could have been maybe a little bit easier or maybe a little bit faster had I made some decisions earlier than what I did. So that's number one. Number two, you can't expect people to invest in you if you don't invest in yourself. And that is something I've also learned is, when you think about whether it's coaching, whether it's, therapy, life coaching, some people are afraid of therapy because they think something's wrong with you and you have to go to therapy. But, getting a life coach or, some sort of coach that can really help you kind of talk through where your brain is and where you want to be. I think spending some time really manifesting that positivity and picturing what you want your future to look like. I wouldn't have just made that up myself. Like that's something I got from coaching. So, everybody probably needs a therapist or a life coach, even if you don't feel like you're really something wrong with you. But
most of
like I said, the pros all have coaches, and I'm sure they do a lot of mindset stuff and, visualization of winning and, all that kind of stuff. So, I played softball in college and I remember us doing a lot of work on, visualizing that home run and visualizing the positive things instead of walking up and going, oh no, I hope I don't strike out again. It's yay. I'm watching myself get that big hit, so I would have told my younger self to really spend more time in taking care of me and getting some support and coaching way earlier than I did. Before I was crying my eyes out, rock bottom, I got to find some help somewhere, and now I'm searching for a business coach where, had I done that, just when everything was good and it's like, oh, now let me have a coach that can, help me make it better. It would have been a lot easier.
Very interesting. I like that. Dr. Duffy, if someone wants to reach out to you and get you maybe as a coach, how they can get in touch with you, what's the best way to be contacted?
Facebook, I'm all over Facebook, so you can just find me on Facebook, Aimee Duffy. My website is aimeeduffymd.com, and Aimee is spelled fancy. It's AIMEE. So that'll be in the links, I'm sure. As a patient, if that's an interest of yours, then it's carolinaintegrativemedicine.com is my my clinic. And then Aimee Duffy MD is my sort of personal page, if you want to call it, for speaking, for my books are there, and then reaching out, for mentorship.
Awesome. That's great. I hope a lot of people will reach out to you because I think they can learn a lot from you and from your experiences. Thank you for having on.
Take care.
That's a wrap on Stellar Success, Leveling Up for Medical Pros with Dr. Tudor Francu. Interested in joining us? Go to stellarsuccesspodcast.com/guest to apply. Stay stellar and level up.